All right. Good morning, everyone. Thank you for joining us. Like we did a couple of weeks ago, I wanted to provide an opportunity to do an update on the mass care exit. As you all likely know, mass care has a firm end date of June 30th. And in working toward that end date, there are many pieces of mass care that have been unwinding. And as I talked last time, just to kind of recap a little bit, in support of that unwinding, the coalition, the Anchorage Coalition to End Homelessness, has requested and received disaster technical assistance from HUD. And so I just want to recap kind of where we've been since we talked last, and then turn it over to Assemblyman Felix Rivera if he has any updates he would like to give. And then if there's anyone on with the administration, if they had any updates. So first, I wanted to indicate that we have closed down a few of the mass care sites since we last spoke. In particular was the Sockeye Inn and the Alex Hotel. So as you all may be aware, the Sockeye Inn, it had some individuals. It wasn't a primary mass care location, but it did have individuals sheltering there from the municipality. Through a significant effort, coalition, Catholic Social Services, Anchorage Health Department, individuals were we worked intensively with them, and individuals all moved on to other situations, none of which included shelter. So that was a successful unwinding of that facility. And as many of you probably know as well, that facility is now closed, but will reopen in June as a complex care shelter. The other facility that unwound was the Alex Hotel. That Alex Hotel had been a mass care site for non-congregate shelter. That ended on the end of March. What we were able to do there with partners is to change the programming to a housing stability program. For 67 rooms. And what that did was it used a different opportunity, which is housing stability funds in cooperation with Alaska Housing Finance Corporation. It is a multi-organizational effort. It is run by a combination of Beans Cafe as well as 99+1. Catholic Social Services is also on site, as well as the Anchorage Coalition to End Homelessness, and some cooperation with the health department to intensively stack services to work individuals towards housing. And we're happy to report that a majority of the individuals there are on a path toward housing, and successful housing placements are happening. What we're finding with these deadlines is the opportunity to really collaborate and intensively stack services amongst providers to work toward housing individuals who have been at these locations. So those efforts continue, turning our attention toward the Sullivan Arena and the Aviator Hotel. This week, we will have the HUD Disaster Technical Assistance back in town, assisting us with getting individuals eligible for the emergency housing voucher. So that is an opportunity to have a subsidy for housing, but it takes some paperwork, it takes some effort in coordination with providers, and then also with the Alaska Housing Finance Corporation. And then once those applications are processed, individuals get to work toward looking for a place. But those things happen kind of in parallel. We're also working with our partners at United Way and the Landlord Housing Partnership to identify units. So when someone's ready to go to housing, we have housing ready and available. So there has been a lot of work happening. We're seeing good success. We still have challenges ahead. We're just at a little over 10 weeks remaining until the closure of mass care. So it is still a very intensive period, but looks like we're headed in the right direction to actively house as many individuals as possible. And we wouldn't be able to be on this track, quite frankly, without cross-organizational support. The teamwork and the collaboration has been really fantastic. And so I just want to take a moment to acknowledge all of our partners who have come along with us, who have stretched and expanded, and really worked toward our housing first goals as we work toward this June 30th deadline. So with that, I'm happy to turn the floor over here to Felix.
Great, thanks. So I just have a few things that I wanted to add. First is for folks who are looking forward to attending the second listening session regarding the Navigation Center. Folks may remember that initially it was set to be April 28th. That has actually moved upward. And I'm thankful for the administration for agreeing to do that, just based on a lot of the concerns we got from folks in the community, to April 25th from 5:30 to 7:30 in the Assembly Chambers. So for folks who are interested, a week from today will be the second listening session. I have put in a variety of requests to the administration for the second listening session on the Navigation Center to make sure it is fruitful and helpful for both community members, but also for us who are the decision makers, to make sure that we are hearing informed opinions, and the only way you can have informed opinions if you know what is actually going on. So I've asked for a variety of presentations regarding the Navigation Center, and for the decision makers to be on the dais, able to respond to whatever comments folks may have. So hopefully we'll have much more of a better dialogue in that second listening session. And then, of course, on April 26th, this is what it's all leading up to, the appropriation for the construction of the Navigation Center will be before the Assembly. And, you know, of course, like Meg said, we have just, you know, weeks. It's literally counting down the weeks, how much we have left before mass care exit and that June 30th deadline that we've imposed. And really fortunate to have so many different partners at the table who are focusing on housing. And really fortunate that so much of our mass care exit strategy, whereas maybe we focused initially on shelter and increasing shelter capacity, we're really starting to broaden our thinking to think about housing and how we can really skip that shelter piece and go straight into housing. So looking forward to engaging in that work, not only through June 30th, but beyond that, because we know this needs to be a long-term focus and strategy for the municipality and for our community partners. Thanks.
Sasha, I'm not seeing anyone on from the administration. If I missed you and you want to add any words, just let us know. Otherwise, I think we are ready for questions.
All right, I am not seeing anyone putting their name in the chat. If you are with the press and would like to ask a question at this time, yes, I see some. If you could put your name and who you're with in the chat, that would be wonderful. And if you are not with the press, feel free to email communications@aceh.org and we will get back with you as soon as possible. But if there are, oh, Lex, can you go ahead, Lex? I see that someone says you have your hand up. It's hard to keep track of when they raise their hand on that. It's hard to keep track of who raises their hand first. So let's start with Lex and then we'll move on to Emily. Go ahead, Lex. You'll have to unmute yourself.
Am I unmuted?
Yes, there you go.
Okay, great. Thank you so much. This is Lex Trinan with Alaska Public Media. I guess my first question, last time at the last press conference, I think Meg had mentioned that goal of housing 10 people per day. I think it was until the mass care exit is complete. Is that goal being met? And if not, what are the challenges to meeting it?
Yeah, thanks for that question. So I haven't looked specifically at the numbers compared to the goal because we've been in the thick of housing folks. One thing we're working on and should have available before the end of the month is a housing dashboard. And this will take the data on our housing placements and put it all in a really easy to capture place to take a look at. But we are having good housing success. And I want to highlight two things. One, we're able to wind down actually 3 mass care locations. I apologize. The guest house had also been the quarantine and isolation, and there had been some individuals there for mass care. When that operation ended recently, also, again, we're able to wind down without placing individuals in shelter. So we've been able to wind down 3 locations with no outplacements to shelter. So I think that is really a harbinger of success, because that's what we're hoping for, is people to be on a path to housing or in housing and not moving from a mass care location, my goodness, mass care location into shelter. And then when that dashboard's available, I'll make sure, Lex, that you and everyone has, that's kind of the same notification that went out here. We can notify you when the dashboard is up and ready to go.
And then we have Emily with ADN. Please go ahead and unmute yourself.
Yeah, a quick clarification, follow up on that answer. What remaining locations are there to stand down in terms of the shelters? And then a question for Felix. You said you had put in a variety of requests for the second listening session. Can you just break down what some of those are, what information you hope will be available, or if we might see some folks from the administration in attendance as well?
So Emily, for your question on what mass care locations remain, that is the Sullivan Arena, and then there's one non-congregate location at the Aviator Hotel.
All right, I believe Maggie Rhodes is next.
Actually, and there was a question for me that Emily had. So the specific presentations that I asked for, Emily, were surrounding basically all the different components as I see them. So everything from procurement to Title 21 to Title 23 to operations and design, that we really present the full package of the work that has gone into the navigation center, so that the public is aware, because there has been, frankly, a lot of work that's gone into this. And it was, from my perspective, very disappointing to see that none of that work was really showcased at the first listening session. So that is my request for the administration. Whether they listen or not to that request, whether they have folks from the administration there to present or not, is up to them.
All right, sorry for cutting off there. Go ahead, Maggie, if you would like to unmute yourself.
I actually did not have a question.
You were just putting your name in the chat, no worries.
Yes. Yep.
All right, I am looking, I'm not seeing anyone else in the chat. All right, is there anyone else that has a question from the press? Please.
Sasha, Lex stands up again.
Oh, go ahead, Lex. I'm sorry, I'm not seeing. Oh, there it is. Yeah, you're in the corner.
Sorry. Yeah, this is Lex with Alaska Public Media again. Sorry if I missed this. I think you mentioned this, but can you just explain the situation with the guest house? You said it was being, is it still being used, or it was completely cleared out of folks from mass care?
Yeah, so it was used as the quarantine and isolation location and for some individuals in mass care, and it was completely, I believe, it lasted just a little bit longer than the other mass care operations that closed at the end of March. I believe as of last week, it was completely closed, where everyone had been placed out to a housing program or housing.
And so it's not
a program of their choice.
And so it won't be used as any part of this mass care plan?
I'm not saying that. I am saying it is no longer used by the municipality as a mass care location. So those are the FEMA reimbursable shelter locations.
But it may be used for the mass care exit strategy. Is that right?
I'm not at a liberty to say what any particular hotel is. As we've stated before from the facilitation, any hotel that may or may not be purchased can't be disclosed until a purchase sale agreement is signed, which is a fairly standard operation in a real estate transaction.
Gotcha. Thank you.
All right, with that, I am not seeing any more questions. I see that there is someone in the chat that is not with the press and has a question. Would love to get your email and we will respond to you as soon as possible. Oh, go ahead, Emily. I see you.
Yeah. Could you just tell me about how many people are still staying at the Aviator? Thanks.
Sure. So if you look at the dashboard, the mass care dashboard on the health department's website, or actually if you do the COVID dashboard and you click on data, there's a mass care dashboard. That's where you can find the occupancy. So there's one non-congregate location. And then if you look at the top, it'll say the number of occupants. And that's because some rooms have more than one occupant if they're a family or a couple. I believe it's 241 in 220 some rooms. Sorry, I don't have it committed to memory because I can check the dashboard all the time.
Got it. I see that there. Thank you. So that's all the folks who are at the Aviator in the non-congregate.
Yes.
Yeah. Okay. Yeah, it's 241 right now. Okay.
You've got Lex's hand again. I'm not sure.
Yeah.
In the corner.
Go ahead, Lex.
Thanks. Yeah, one more question. I'm just wondering, I know this was brought up at the listening session, and I don't know if, this needs to be directed to the administration, but I'm just wondering how, the folks that are in mass care now and, at like the Sullivan, for example, are being included, if at all, in the process of, trying to determine what is best for them. Is there a way that they are actively being reached out to or engaged with?
So I'm happy to respond here. So I am not sure whether the administration is actively reaching out to folks to get their, at the Sullivan or any other clients who are experiencing homelessness, to get their firsthand knowledge and experience. I will say that one of the other requests that I made of the administration after the first listening session was for them to organize such a listening session or roundtable. And so, again, it'll be up to them whether they decide to listen to that request or not, but it has been sent to them.
And you mean hold a roundtable like with folks experiencing homelessness at the Sullivan or something, or what exactly was that request?
Yes, yeah, that is exactly what the request was.
Got it. Thank you.
I'm not seeing any more hands or comments.
I have one more. Sorry.
Go ahead, Emily. Go ahead.
I'm looking at the dashboard right now, and for the congregate shelter that shows 0 occupants. Why is the data not in the dashboard, and how many folks are staying at the congregate shelter right now?
Yeah, thanks for that, Emily. I actually emailed Health Director DeRace this morning. I saw that as well. It's the health department that keeps the dashboard, so I'm not sure the why. I believe it's fair to say there are probably around 300 individuals at the Sullivan Arena. but I can't tell you with any certainty without the dashboard or pulling a report from our homelessness management information software or system. And I haven't had a chance to do that today. I'm hoping that the dashboard is back up and running, because that is based on kind of the overnight census count. And so it's a live count versus the data, which might have a day or two lag to it.
Thank you.
All right, any more questions? If there are no more questions, I think we can end a little early today. I'd like to thank everyone for showing up. Appreciate your involvement and the coverage. I will upload this recording to our ACEH YouTube. So I'll put a chat there with that information. Thank you all and have a great day.